How's it going, everybody? Thought I would do a live today, just talking about some things that I've been questioned about lately. So I'm going to jump right in. Some of the things that I've talked a lot about in the comments are symptoms and what I do personally to treat those symptoms. So everything I'm going to say here is not medical advice. I'm not a doctor. You have to check with your doctor before you do anything. These things affect everybody differently, but I'm going to list off some symptoms and tell you what I do for those symptoms. And maybe you guys do something similar or something very different. Let me know in the chat. So number one, fatigue. For fatigue, what I generally do is, this is pretty obvious, but I rest as much as I can, and I get my baseline. I stay below my baseline so I don't go in the anaerobic threshold or past my anaerobic threshold. I try to avoid crashes by staying under a certain heart rate. Now that heart rate's different for everybody else. And what I do is I stay as hydrated as I can. I do Epsom salt baths, and I eat as clean as I can to stay away from inflammatory foods. That's about all I can do to wait out the fatigue during the crash. Brain fog. With brain fog, I try to, again, stay as hydrated as I can and rest as much as I can. Those are two things that are tough. One thing that I forgot about fatigue that also applies to brain fog is LDN, low dose naltrexone. That's one thing that helps a lot with fatigue and brain fog. So as far as taking a pill, that's what's helped a lot with fatigue and brain fog alike. Gut issues. Another issue that a lot of people with ME and CFS have and deal with. The number one thing is avoid sugar for me and find a probiotic that works, or more than one. That's what started to get the gut issues somewhat under control, and eating fermented foods. So those are just a few things for, I would say, the major symptoms and issues. And then next, I would say insomnia. And for insomnia, I take prescription sleep medicine to help me sleep. If you don't sleep, the fatigue flares up, the brain fog flares up, the gut issues flare up, at least for me. So none of these are in any particular order. I'm just firing off symptoms and things I do to help them. Another one is blurred vision, which I started to get a lot in the beginning of this. And what I did for that is glasses. That does help, although I still get blurred vision when I'm wearing the glasses. Numbness and tingling. I try to stretch as much as possible and move around as much as possible without causing a crash or PEM. So that does help with my numbness quite a bit. Sometimes my hands, I stretch them. I do as many stretches as I can, keep the blood flowing as much as possible. That does help with my numbness. Joint pain, same, stretching, massages, and Epsom salt baths is what really helps a lot with that. Stiff muscles and pain, same thing. Epsom salt baths, massages, stretching as much as possible. Sometimes more than once a day as far as stretching, just to keep loose and keep that inflammation down. Swollen lymph nodes is another symptom that I deal with, and there's going to be a lot of symptoms on here that many of you may or may not have. But these are just symptoms that I deal with pretty much on a daily basis. Swollen lymph nodes, for me, I get really pretty big swollen lymph nodes here. Sometimes they affect my vocal cords. And lymphatic massages help, and fluids help quite a bit too. So that's what I do for that. Sore throat. Honestly, I haven't found much help with that, other than warm tea helps a little bit, some chamomile tea with lots of lemon and a little bit of honey. But that's one thing that I haven't really been able to figure out at all, any help with. Dizziness. This has been a big one for me as of late. And what I do are very basic vestibular exercises. You can look those up online or talk to your doctor about them, but I do very basic ones. Eye movements and head movements that kind of help calibrate the balance a little bit. That has helped with my dizziness somewhat. Heart palpitations. That's one thing that kind of just comes and goes without any rhyme or reason. Don't have much of a treatment for that other than breathing exercises. Some people say it's anxiety, but I notice it kind of hits me when I'm at my most calm. You know, it doesn't really, anxiety's never really been a thing for me. I know how impactful it is for a lot of people, but for me, it's never been a major symptom. But I just work on breathing exercises for the heart palpitations. Sometimes it works, sometimes it doesn't. Another symptom is post-exertional malaise, and that kind of ties into brain fog and to what I do for fatigue. LDN helps a lot with post-exertional malaise, and really staying in your baseline so that you don't have crashes and get into the PEM nightmare that we all have. Headaches, I try to massage the scalp as much as possible and stay hydrated as much as possible. I've noticed that headaches are very, very common with ME and CFS. Noise sensitivity. Don't have an answer for this one as far as treatment other than wearing earplugs in obvious moments. I'm wondering what other people do for that. Maybe I'll see in the comments or in the chat what people do for noise sensitivity. Food sensitivity, I just try to keep a journal and see what food causes what symptom and how I can avoid those foods. And that's really helped a lot because there have been foods that have triggered symptoms. Stress. What can you do for stress? That's a thing that flares up a lot of symptoms that I've already mentioned. I think breathing exercises, Epsom salt baths, and just overall approach of taking your time with things really makes a big difference, which is hard to do. Let's see, what else do I have here? Shortness of breath. Hi, Ruth from the UK. How are you? How you doing? Shortness of breath. I think the best thing you could do again is stay in your baseline. Sometimes I'm more short of breath than other times, but if I stay in my baseline, a lot of these symptoms aren't as bad as they can be. They can be very vicious if I don't stay under my baseline. And that's why sometimes people might say, fine, you look okay today, you're doing all right. It takes a lot of work, a lot of effort to stay under that baseline, to not have all these symptoms just engulf you. So that's basically the most common symptoms that I have. Those are the things the basic things that I do to help them. Obviously, there's B12, CoQ10, a lot of supplements out there, but they kind of work differently for everybody. So I just wanted to really just mention very, very basic things that I do for each and every symptom that I listed. A lot of people will often ask me in certain comments or conversations what I do for a certain symptom. So here's one big rundown in one video of what I do for the most common symptoms. I also wanted to, I'm going to come out with a video soon on this, but I also wanted to talk about caregivers, how important caregivers are to ME and CFS sufferers, and how vital they are to our everyday well-being. And I have a video coming out in a couple of days really talking about that. I wanted to make a video just thanking caregivers and family members and people who did not abandon people with ME and CFS. There's a lot of people that I talk to, and it's heartbreaking to hear. There's a lot of people that I talk to that have family members they don't talk to anymore. I mean, I have family members I haven't talked to in years because they didn't understand ME and CFS and don't to this day. And as difficult as it is, you have to cut people like that out until they understand. But for the people who stuck around, for the people who understood, for the people who educated themselves on understanding, and for the people who take the time every day to help, whether it be checking on you, whether it be emotionally, physically, mentally, financially. And that's what the video is going to be about. It's just going to be very short. It's not going to be very long. But I'm hoping that people with ME and CFS who don't have the opportunity to thank those people, whether it be time or their illness, and they just can't articulate how they feel with the amount of brain fog that they have, I'm just making like a 2-minute video thanking caregivers one really important and vital aspect to ME that no one really talks about. We often talk about symptoms and people not understanding, and doctors, and the overall kind of toxic outlook the medical community has had in the past towards ME and CFS. But man, those unsung heroes who are there day in and day out, the ones who call and check on us, the ones who keep our spirits high, they're not talked about enough. So I'm hoping that the video is appreciated by those who see it, because we appreciate them. So yeah, that's kind of all I wanted to get out today, as far as symptoms and kind of talk about caregivers at all. If you guys have any questions in the chat, I see a couple of you from the UK. Got some friends from the UK. How are you guys doing, Don and Ruth? I hope everything's okay in the UK over there. I know a lot of times I read things about the UK, and there's still a really bad stigma over there with ME and CFS. A lot of the doctors don't believe it. I still see people in the UK talking about graded exercise therapy and all these things, and it's very disappointing to read. I'm hoping that changes. So it's frustrating to still see people talk about graded exercise therapy as a valid treatment for ME and CFS, even though there's been so many studies proving that it's actually harmful for the vast majority of people with ME and CFS. In fact, there's lots of channels on YouTube and things like that dedicated to talking about how they were cured from ME from graded exercise therapy. And although I do think they've been cured, such a small percentage benefit from graded exercise therapy, and so many people actually are harmed by it. I really wish people would consider putting that out there more, how dangerous it can be, instead of just kind of glorifying graded exercise therapy, even though it may have worked for them. I find it to be a very, very dangerous treatment. Let's see, Don says, my worst symptom is the feeling of being about to faint even though I don't. That's a terrible symptom. I've had it from time to time. Yeah, that's tough. That's a tough one. I wish I had a helpful answer for that, but I don't. That actually happened to me yesterday. I think I may have just got up too quick, which is common even if you don't have ME and CFS, but not this bad, and I don't even get up that quick. So that's a little bit concerning when you get up somewhat slowly and you get faint and dizzy and you feel like you have to grab onto something. It scares the people around me. Sometimes I get up and I have to grab onto something and they get kind of freaked out. Not much I can do for that one. I just kind of let it pass. Depression, anxiety help from Priscilla Lee. I've never really dealt with anxiety, and I've never really dealt with a lot of depression. I'm very empathetic to people that have, but it's not something that I'm very familiar with. I really, when I was a little bit younger, my dad passed away when I was young. And I think that's the only time that I dealt with some depression. And ironically, the only way that I have known to deal with feeling like that is to exercise a lot. And we can't do that. So I don't really know, outside of taking the proper medication for depression. That's something you should talk to your doctor too. I personally think it's detrimental to tell people with ME and CFS to take antidepressants from the get-go. Now, if you've developed depression because of ME and CFS, then I think it's something you should talk to your doctor about. But when you go and talk to a doctor about ME and CFS and you talk about your symptoms, and you get thrown medication at you right away, that's a bad sign in my opinion. But I do think it is worth it to try antidepressants if you've been dealing with it for a long time. Dawn Lovejoy, are there any nutritional supplements that would help? Do you mean just ME, CFS in general, or do you mean for depression and anxiety? As far as supplements that have helped me overall with ME and CFS, probiotics are a good, high-quality probiotics, not the ones you just get off the shelf that are shelf-stable. I mean, ones that have to be refrigerated, have live culture in general. Okay, so I would say really high-quality probiotics help ME and CFS. At least it's helped me. It's helped with brain fog. I feel like when my stomach flares up, the brain gets a little bit of inflammation. That's how it feels, and I get the brain fog. So that's number one. Low-dose naltrexone, I know is not a supplement, but that's a really big one. If you have ME, CFS, I really think you should be considering low-dose naltrexone. Talk to your doctor about it. A lot of doctors still aren't familiar with it. Do some research on it. Go on and kind of bring your doctor the research that you have found. CoQ10 helps with energy, or has helped me. Again, talk to your doctor before taking any of these things. Supplements can hurt you, so keep that in mind. Fish oil is another thing that I've taken that has helped. Milk thistle is another thing that has helped. Those are all supplements that you should talk to your doctor about before taking. But I think people with ME and CFS in general have taken a lot of those supplements, and a lot of people have seen some symptoms subside a bit. And I've taken a lot of these myself, and I have found that they have helped. But I had a lot of trial and error on what worked, what didn't. Some I had adverse effects to, so keep that in mind. Even though they're over-the-counter supplements, they can be harmful, especially to people with ME and CFS. Ruth says, you were talking about lymphatic massages, but in the current circumstances, it's not really possible. That's true. I use what does that say? Sun Ankin Chi machine. Never heard of that. I don't know if I pronounced that or butchered that. You can check it out online. I use it now every day. I'll check it out. Never heard of that. Yeah, massages now are not an option, unfortunately, but they are extremely helpful. Regular massages and lymphatic massages were so helpful to me, and now with everything that's going on in the world, it's not as easy to do. Don, I have depression and anxiety. Meds help, but also trying to practice self-care and avoid as much stress as possible. Also did months of therapy. I think you're on the right track. I think you have the right mindset. You're on the right track. Self-care and avoiding stress is a big one. And anxiety, it's tough. I don't think I've really had severe anxiety in my life before. But I do know anxiety is worrying about something that hasn't happened yet. It's picturing something bad happening and having the feelings of that happening without it happening yet. And whenever I am anxious, or I don't know if that's really considered anxiety or not, but if I'm anxious before doing something, I just try to stay in the moment as much as possible. And I find that helps me a lot. As simple as that sounds, that works for me. I don't know if that'll work for other people, but that really does work for me, is to really stay in the moment. I can't control everything else that hasn't happened yet. Let's see. Ruth Joy, the movement helps with lymphatic drainage, but no energy expenditure required. That's great. So if you could do those things without going into post-exertional malaise and causing crashes, that sounds that's really great. Dawn, frustrating here in the UK as they will push graded exercise therapy and cognitive behavioral therapy as the answer. That's so frustrating to hear. I'm sorry. I don't understand how a modern area like the UK can still push that nonsense. Very frustrating to hear. And in the US, some places do it too, but it's starting to kind of phase out. Very frustrating to hear that that's still happening. How much evidence needs to come out that graded exercise therapy is detrimental to with ME and CFS? I don't get it. I'm trying to interview some doctors that do cardiovascular pulmonary exercise testing or CPET testing. I'm trying to set up an interview with them next week for the channel. They can explain a little bit about post-exertional malaise, what exercise actually does to people with ME. I'm hopeful. I hope that's helpful, and hopefully they get into I'll ask the questions. Hopefully they get integrated exercise therapy and how dangerous it is. Sorry to hear that they're still doing that. Don Lovejoy, I used to overthink everything. You know what? I think all of us with ME, CFS, any illness like this, you have a lot of time to think. So even if you're not naturally an overthinker, I think you're gonna overthink things a lot. A lot of us can't do what we used to do, and it's frustrating. And we think of what we once were, what our future was gonna be, and all these different things. So I don't think you're alone, Don, in being an overthinker with things or dealing with that issue. Tata B, hi, how are you? Good to see you again on here. So yeah, that's those are the symptoms I deal with. Those are some of the things that I do. And hopefully you can talk to your doctor about them. Those of you in the UK, do you guys take low-dose naltrexone, LDN? Have you talked to your doctors about that? To me, I think that's probably one of the best treatments out there at the moment, when taken properly and gotten at the proper pharmacy and done correctly. I think that's probably the most important thing you can do. But you have to find a doctor to prescribe it to you, and you have to find a doctor that knows what they're doing. So that's the main hurdle, in my opinion. If you guys have any other questions or any topics, throw it in the chat. If not, I'm going to wrap up here. I wanted to just do a quick live, say hi to you guys, and just kind of go over the symptoms and things I do to treat the symptoms that I personally have. Like I said, that is a very common question that I get. Susan Becker, hi, I have POTS, which feels like the biggest problem. Do you have it? I do not. I don't, but I do have dizziness a lot, and maybe I have some more issues in there that I'm not aware of, but that I know of, I don't have POTS. I know a lot of people with ME, CFS do or develop it. I have had vestibular neuritis, which has been a nightmare. This was over a year ago, and I'm still dealing with it. Daniel, good to see you on here again. How about the low carb versus vegan versus vegetarian? Thank you, and good to see you in the chat again. I have tried every diet that you can imagine. For me, low carb, low meat has worked for me lately, but sometimes I go paleo and I just do lots of meat. There's no rhyme or reason, really. I just try to eat as healthy as possible, as clean as possible. I eat cleaner than most people I know. If I start eating processed foods, sugars, all that garbage, I immediately start to flare up. Gut issues, brain fog, all the things come back. So I'm just generally a good eater. But Daniel, I do know a lot of people that eat vegetarian, and they feel a lot better. So I think it's worth a try. Let's see. I have a cousin with ME2 wondering if genetics plays a part. Well, there's a lot of things out there. There's a lot happening right now where genetics, it's pointing that genetics do play a role. But I don't know if environmental or genetics plays the larger role. I think we're probably going to find that out pretty soon here. I have other family members with autoimmune diseases. That's a little bit odd to me. We didn't grow up very near each other, so I'm not sure how environmental that is. But I would not be surprised if you're predisposed to, if your genetics give you like a predisposition to having an autoimmune illness. Me personally, though, I think something triggers it. I think this is just, I'm not a doctor or a scientist, but I think that something viral or some type of trauma, big surgery, big accident, head injury, triggers these things, and we might already have a predisposition to it. That's my theory, Johnny's theory for the day. Let's see, what else do we have here? Definitely interested to hear about the 2-day CPET testing. Yeah, Ruth, hopefully I've reached out to them, and I'm trying to schedule with them. His name's Dr. Snell. He's an expert on post-exertional malaise and the CPET testing. So I'm hoping that I can do it soon and get it, because I'm actually really surprised that a lot of people in the ME-CFS community don't know about CPET testing. It's very important when proving disability, and it's very important just knowing where your baseline is. It's extremely important, and a lot of people don't know. So hopefully the video is informative, and hopefully I get some good information from Dr. Snell. Let's see, Don, mine was triggered by a viral infection. I think a lot of people remember a bad viral infection that triggered ME-CFS for them. I think you're seeing that a lot with long haulers, COVID long haulers right now. I think we're probably going to see an influx of people with ME and CFS, unfortunately, because bad viruses seem to be triggering these autoimmune diseases, not just ME and CFS. I had really bad case of chickenpox when I was like 15. Got super, super sick, and my health was never really the same after that. Before that, I was never sick, about as healthy as you could be. And then after that, I noticed I wouldn't recover from things the same, and it kind of just all went downhill after that. So I have a similar experience after having like a bad viral infection. I think that's pretty common. Well, I'm going to wrap up here. I'm going to do another live in a couple weeks. Like I said, I'm going to put out a video about caregivers, and I'm going to put out a video hopefully soon with an interview with Dr. Snell, the CPET specialist. And I'm working on another interview. Hopefully I can confirm it'll happen. Don't want to give information out yet, but I have a big interview. Hopefully that's going to happen here soon with someone that I think a lot of you guys are going to be excited to hear from. So hopefully that happens. I'll keep you guys posted. I hope everyone's taking care and stay safe. Do everything you can to be as safe as you can with COVID and everything that's going on in this crazy world. Take care of yourself, listen to your body, and stay below that baseline and avoid those crashes. Thanks for joining me in the chat. And if you watch this after the live, thanks for watching. I appreciate it. And until next time, take it easy.